There's an ongoing collaboration amongst physicians who are working together for the Niagara Family Physician Dementia Community of Practice. Joining me in the studio to share the impactful initiatives that are currently underway is family physician Dr. Ehab Wassif and CEO of the Alzheimer Society of Niagara, Teena Kindt. So Teena, why don't you tell me how this came to be?
Thank you for having us today. So the Dementia Care Working Group came out of the Niagara, Ontario Health Team back in 2022 because we identified dementia as a priority population here in Niagara. We are well over the numbers of the provincial average. So that's where myself and I co-lead this group with Casey Knight of the Welland McMaster Family Health Group. So we developed this care group, and so one of the things that we did back in 2023 was to have some workshops, talk to physicians, see what their barriers, what their challenges were. And there was one workshop with all the physicians, and they really identified that they needed a community of practice. They needed to talk to one another, learn their strengths, their weaknesses, their challenges, and what would be best for the Niagara residents. So that's where I did apply to the Niagara Community Foundation. They did give us a grant, and so we did go out in July, of this summer, and Dr. Wassif is our lead physician for that community of practice.
And so Dr. Wassif, why don't you tell me a bit about the Niagara Memory Clinics and how you support patients with dementia as well as their families?
So I started that in 2011. I attended one of the workshops to start having a memory clinic in our family health team, the Niagara Medical Group. We trained with Linda Lee. She is the lead physician for Dement Memory Clinics and has been practicing and delivering care to the roster of our patients in our group. During COVID, things went awry. We could not see patients in person. The hospital was jam-packed, and dementia care became really strained during that time. By March 2023, I attended one of those workshops, and at that time, the wait time to see a geriatrician in the community was about 5 years.
Wow.
For non-urgent cases. As you see, that there was a huge demand to see how we can improve that. The access time for patients to be at least diagnosed and maybe started on a treatment. So the community of practice was an area of concern of all these physicians. How can we collectively work not just within our family health team, but expand the care? And from that workshop, we came up with the idea of the community of practice, and there were some deliberation about how to open the different memory clinics that runs from every family health team to the community as well. So came the mobile clinic as well. And in July of last year, I interviewed with Teena here to become the lead physician for that community of practice. As we started that, one of the biggest issues that we identified is not just access, but how we can communicate with our patient once they are diagnosed with dementia or having difficulty managing their activities of daily living, when to stop driving.
And so that's where I guess you're piloting this CanDrive's driving risk stratification tool in the memory clinics. Who would be best to tell me a bit about that?
So Dr. Wassif would be best to,
Okay.
but we deal with that a lot within the Alzheimer Society. The loss of independence for someone losing their license is devastating, right? So, and they're the bad guy that takes it away.
Yes.
So that's where this would certainly help with that gray area.
The simulator that we are working on right now, from that same group of researchers, they can drive, they were able to determine that using a specific simulator that would be an equivalent to an on-road test without the risk of having someone having an accident, so use a simulator. So what we are doing is we're going to use a risk stratification tool to determine who would be eligible to go for that simulator assessment.
Okay, so Teena, why don't you tell me about what is needed next?
So we've got the funds to purchase the simulator, which will be software and then a driving and feet and that sort of thing. But we're looking for a location. We want something central across the Niagara region. There's 6 memory clinics. We don't necessarily want to house it in one of them so that they can all access it, those 6 memory clinics. So looking for a spot, central, reached out to a couple locations around Brock University, but also if anyone has any space they would like to donate to us, we would definitely talk more about having that simulator itself. And as well, the community of practice. We've got funds from the Niagara Community Foundation till September, but looking also then to continue that because it's been such a worthwhile project. Like having these physicians come together and speak about their challenges has been extremely worthwhile, and it will benefit other family physicians in Niagara. And I think this is probably groundbreaking for Niagara.
Excellent. Well, thank you both for joining us in studio today.
Thank
Thank
you.
you.